Hi, my name's Mel. I'm going to be talking to you about how we treat cancer and the side effects of those treatments. But first, we'll talk about the services at UHB. We have day units based on all of the hospital sites. So at the QE, we have our day unit on East 1A. We have a haematology day unit in the Centre for Clinical Haematology. We have a day unit at the Heartlands Hospital, a day unit at Good Hope Hospital, as well as a day unit at Solihull Hospital. We also have our inpatient wards, which are all based at the Queen Elizabeth Hospital, and that's wards 623, 624, 625. Ward 622 is our admissions ward. We also have a community outreach team where our nurses are able to go out and give treatment in patients' homes, as well as a research facility, which is the Wellcome Trust Clinical Research Facility. So patients have more than just nurses involved in their care. So people that would be involved in your care include the doctors. We have booking coordinators that are responsible for ensuring that you have appointments booked for your treatment as well as for your doctors. We've got dietitians, phlebotomists and pharmacy as well, who are involved in dispensing and also making up your treatments. Cancer happens when a normal cell has DNA damage that occurs. That can occur for a variety of reasons. When this damage happens, the cell would normally just die or the body would kill it off. With cancer cells, this doesn't happen as a natural process, and that cell then goes on to become a cancer cell. There are various treatment options for patients who have cancer. Chemotherapy is the most traditional, but there are also other options. Surgery, radiotherapy, targeted therapy, hormone therapy, as well as bone marrow transplant are all methods used to treat cancer. At diagnosis, or after a diagnosis is made, there are various other steps that occur. So if treatment is given before surgery, this is referred to as neoadjuvant. Adjuvant treatment occurs after surgery. How is chemotherapy given? There are various ways in which chemotherapy can be given. The most common one is via a drip in the arm, which is an intravenous infusion. But we also have other methods of administering chemotherapy, such as oral, whereby you're given tablets. Intramuscular is an injection into a muscle, or subcutaneous injection, where it's actually given into the tissue just under your skin. What can you expect when you actually come for an appointment prior to chemotherapy treatment? Your first appointment with a nurse would be for a new patient assessment. At this, we would check that your consent has been signed. You have observations done. We will do a tour of the unit where you're actually having your treatment. We'll assess your veins to ensure that they are actually adequate, and if need be, we'll refer you to have a long-term line or a PICC line inserted. You'll also be given a RED card or an acute oncology service card, and you'll be offered scalp cooling as well as advice on how to deal with side effects. Prior to treatment, there are various investigations that will take place. These include things like blood tests, COVID tests. In some cases, you might need to have a heart test as well, but your doctor or your specialist nurse will advise you of which ones need to be done. At your first treatment, another assessment is done, and that's just to ascertain that you're well enough on the day to have your treatment. Your treatment will commence, and prior to you actually leaving the area that you're having your treatment, you will go home with a new appointment card, and that would be for your next treatment as well as your next doctor's appointments. You'll also get blood forms as well as your medication that you need to take while you're at home. Aftercare, this usually involves the side effects that you might experience, and it's things like getting a temperature, or if you have pain, and what and who you need to contact if these do happen. This is what the acute oncology card, or the red card, looks like. We advise patients to carry this with them at all times. Either slip it into your wallet or into your handbag, so you have access to it at all times, no matter where you are. Some of the side effects from chemotherapy, these can be split into short-term and long-term side effects. So the shorter-term side effects would be things like you might have a reaction to the actual treatment that we give you, nausea and vomiting, there's a risk of infection, you may or may not have diarrhea or constipation. Other side effects which are more long-term, these can affect your heart, your bones, your stomach lining, or your GI tract, and sometimes even urinary symptoms. Fertility issues are also one of the long-term side effects with treatment. So these are just a few tips to keep you going while you're on treatment. Try to stay hydrated. Aim to have between 8 and 10 glasses of water a day. If you find water is bland, you can try adding some squash to it. It's really important that you adhere to a strict mouth care regime. Use a soft bristled toothbrush at least twice a day, and use the prescribed mouthwashes. Very often when you're on treatment, it's difficult to eat 3 meals a day. You will find that actually you might need to eat smaller meals, sometimes grazing throughout the day as opposed to having 3 big meals a day. When you're coming for treatment, when you're at home as well, wear comfortable clothes so that you remain cool and not too warm. You will be given medication to go home with. Okay, do not self-medicate. If you have any concerns, if you have any problems, please contact the acute oncology service, and they will be able to advise you. In most cases, your doctor would have asked you, if you are a smoker, to actually not smoke or stop smoking once you start treatment, and that's just because of the effect it can have on your mouth and on your breathing. We'd like you to be part of your treatment, so ask questions. So if there's anything you're not sure about, please ask the nurse who's treating you, or indeed your doctor as well, your oncologist or hematologist. So just to summarize, we have various treatment services available at UHB. There is a big team of people that are involved in your care, and various options as well. Prior to starting treatment, we do a lot of preparation. Okay, we do preparations prior to you attending, but also with you while you're actually having treatment. Follow-up is essential. Please attend your follow-up appointments, and if you have any queries, please contact the acute oncology service on the red card. If you have any concerns, or if you feel that you're not coping with treatment, please let either your treating oncologist or hematologist know, and they'll be able to follow up with you on that.